Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 5 starts now.
The number continues to rise. Michigan now has more than 20,000 cases of the coronavirus. But as we cross that new milestone, there is a hint of hope emerging inside the numbers. Glad you're with us for Local 4 News at 5. Just in here at 5 o'clock, Governor Whitmer says she plans to extend Michigan's stay-at-home order past April 13th, making that comment in an interview with our sister station, Wood TV, in Grand Rapids.
She says an official announcement on that will come tomorrow, so we will be looking forward to that. For now, let's take a look at today's big headlines. There were 1,376 new cases of COVID-19 reported in the state. Sadly, 114 people have died from the virus in just the past day. Also, General Motors has been awarded a government contract to build 30,000 ventilators by August.
And in Detroit, Mayor Duggan says testing at nursing homes is underway. Also, the TCF Center could see its first patients on Friday. For more on that part of the story, we bring in Larry Spruill, who joins us live with more. Larry.
Well, Devin and Kimberly, testing is just one of the many things Mayor Duggan talked about in today's news conference. He also mentioned that it should get easier for people to get tested in the next couple of weeks. But he did mention that the coronavirus is hitting the African American community the hardest, and it's a conversation he wanted to have now.
What the coronavirus is doing is exacerbating the racial health gap that has existed in this country for a very long time.
It's a conversation Mayor Duggan says has to be on the forefront when dealing with the coronavirus, especially among African Americans here in Metro Detroit.
The life expectancy of African Americans is shorter than it is of Caucasians. That chronic disease, whether it's hypertension, whether it's diabetes, whether it's asthma, whether it's heart disease, whether it's chronic kidney disease, is much higher in the African American community. We had 26 more deaths reported today. 26 more of our neighbors, somebody's mother or father, son or daughter.
Wednesday, Mayor Mike Duggan released the latest numbers when it comes to the coronavirus deaths here in Metro Detroit. Duggan says the numbers are alarming, but there's improvement.
We are seeing the line, the curve, beginning to flatten out.
That's why he's stressing more and more people to get tested.
It is now much easier for doctors in southeastern Michigan to prescribe a test, and this is going to be our goal. I want every single person in the city of Detroit who's showing symptoms to get tested right away.
And we have been talking a lot about the TCF Center opening up. Mayor Duggan says that should happen later on this week. 25 beds will be added on Friday, 25 more beds on Saturday. We're live in Detroit tonight. Larry Spruill, Local 4.
Larry, the mayor mentioned a lot. He hit on a lot of topics at today's news conference and also addressed testing workers at nursing homes.
Yeah, Devin, so he says that will start tonight, where workers at these nursing homes will be tested. He did mention that the testing swabs will be done by volunteers at Wayne State University. They should get those results coming up sometime this week. Yeah. Devin?
All right, Larry. Well, the biggest need right now in the battle with coronavirus remains ventilators.
Yeah, and today the government announced General Motors has signed the first Defense Production Act contract to build them.
Yeah, going to make 30,000 of them by August. Business editor Rob Maloney live in Livonia tonight. Rod, switching from cars to medical equipment, though, is no easy feat.
No, but they did it, and they did it in a very short order. Now, we're looking at the new arsenal of democracy, not building the cars and trucks. And General Motors is now getting ready to start building. Come Monday, they're going to start building and hope to start shipping by the end of the week. This is General Motors' video of its Kokomo, Indiana plant. It converted this clean manufacturing facility, formerly used to make precision electronics, into a high-end ventilator plant in just days. It's already training UAW volunteers and other local residents on the machine's intricacies, and there will be a lot of hands looking to help. Jim Kane's a GM spokesperson.
Like tubes, the accessories like carts and stands, because when these get into the hands of medical professionals, we want them ready to go.
GM went to nearly 100 American suppliers to get the complicated and difficult to build parts for this top-of-the-line lifesaver.
It is a true critical care ventilator, which means it has the precision that lets the respiratory therapists and doctors
Now, we're all following the stay-at-home orders, and you're wondering, how is it you can put so many people so close together to build these most sought-after medical devices? Well, GM is completely rearranging how it does assembly line business, with one-way doors both in and out, and a whole lot more.
The workstations will be 6 feet apart. There's going to be 3 cleaning opportunities across each shift. And then before you even begin work, employees are going to be given the opportunity to wipe down and clean their work areas.
Now, General Motors is going to send these ventilators, as soon as they're made, off to Washington for the national bank of ventilators so that the government can send them where they're needed. Reporting live in Livonia, Rod Maloney, Local 4.
All right, Rod. We, of course, know every day brings more questions about the coronavirus, and Dr. Frank B. George has been working his tail off to answer as many as he possibly can.
He's doing a great job, too, at it, and today he's addressing 2 questions. He's hearing a lot about how the virus spreads. Hi there, Doc.
Hey guys, yeah, we know you can spread the virus when an infected person develops symptoms like a fever and cough. But one concern that's emerging is as a growing risk is something called asymptomatic transmission. As the name implies, this occurs when a person has no symptoms. Now, there is some ongoing debate over whether there is truly asymptomatic spread, where someone has absolutely no symptoms at all. Some researchers believe when these cases are investigated more thoroughly, it's more common that a person simply has very minimal symptoms, perhaps a runny nose or a scratchy throat that they simply dismiss. Regardless of whether the person is truly asymptomatic or minimally symptomatic, they have the potential to spread the virus. That's the biggest reason that we're recommending everyone wear a mask, to minimize the risk of spreading the virus if you are unknowingly in this group. Now, one practical question that has come up is, how long are you contagious if you're asymptomatic? And unfortunately, the answer is, we have no idea. Because our testing is currently focused on people with symptoms that more strongly suggest COVID-19, there just isn't enough information to even know how common asymptomatic or minimally symptomatic spread is. Now, another somewhat related question is, if I've self-quarantined for 2 weeks, is it safe for me to visit someone who is at high risk, like an elderly relative? Well, the answer is pretty much the same. We don't know for sure. But practically speaking, if you've self-quarantined for 2 weeks and have no symptoms, the odds are very much in your favor, although I still would recommend a mask and the usual distancing and hygiene recommendations. Now, regarding spread, there is another factor beyond asymptomatic and minimally symptomatic spread. It's called pre-symptomatic spread. There is actually very good published data that strongly suggests that some people are able to spread the virus between 1 and 3 days before they develop symptoms and even know they're sick, which is yet another reason that everyone really needs to help keep each other safe. Back to you.
It really is scary, though. Okay, thanks for sorting it out for us, Doc. We appreciate it.
Those closely watched coronavirus models show social distancing is working. That's been raising hopes, but also fears that Americans might stop following the guidelines a little too soon and trigger a second wave of outbreaks. Alice Barr in Washington tonight with more. Hi, Alice.
Devin, one prominent model that's showing a trend in the right direction assumes strict social distancing until June. So health officials are stressing now is not the time to let up.
Heavily guarded hope today as new models are projecting fewer Americans may die from coronavirus than some of the bleakest estimates. But health experts warn that will quickly change if we stop social distancing.
If people start going out again and socially interacting, we could see a very acute second wave very early.
Despite those words of caution, President Trump tweeting today the curve is flattening and he wants to open the country sooner rather than later. In New York, the number of new hospitalizations continues to stabilize, even as patients infected weeks ago are now dying in record numbers each day.
Highest single day death toll yet, 779 people.
New York's governor saying those tragic numbers will eventually drop too.
There's a big caution sign. That's if we continue doing what we're doing.
But discouraging new data from the Centers for Disease Control is backing up reports that communities of color, especially African Americans, are getting sick and dying at much higher rates. Experts point to underlying health conditions and lower socioeconomics.
They can't afford to miss a paycheck. They can't socially distance. They can't Uber or Lyft to work.
Today, the White House and Congress negotiating the next round of aid to pump an additional $250 billion into a program to help small businesses stay afloat and pay their workers. Democrats pushing for even more money to help struggling hospitals and state and local governments, with a vote in the Senate expected as early as tomorrow.
One of the biggest questions now is just when will things get back to normal? In one indication, top health official Dr. Anthony Fauci says that summer camp may not happen for kids, but he does expect if we stay on track now, schools should be able to open in the fall. In Washington, Alice Barr, Local 4.
Okay, Alice. Meantime, we have a timeline now from Congresswoman Debbie Dingell on when the stimulus payments will be coming. She says the first 60 million payments should go out in mid-April for those who use direct deposit for their 2018 or 2019 tax returns. If you haven't used direct deposit on those, it's going to take longer to get your money.
A bounce-back day on Wall Street today as investors focus on hopeful signs that a peak in coronavirus cases may be approaching. The Dow closed up 3% at the end of trading. It was its first time above 23,000 points in nearly a month. Both the S&P 500 and the NASDAQ finished up 3%.
Off and running on, if you hope you got outside or at least stuck your head out the window today. It is a beautiful Wednesday, Ben.
Yeah, Devin, dinner on the deck tonight is a great option. And if you don't take it tonight, you may not get that opportunity for a while. We get some big changes in store coming up.
If you've tried to file for unemployment, you know it is incredibly frustrating. That's why today I'm getting answers from the governor.
Checking in with Detroit Reverend Horace Sheffield 2 weeks after he tests for coronavirus.
You know, Sean, every single day I'm deluged with folks that I love and know that are dying.
Tonight, a decision he made 3 years ago about his own health that is really helping him tonight with his own fight.